For the last 200 years, healthcare and medicine has really been focused on fixing the body and the diseases that it's afflicted by. With the VITAL project, what we've done over the last 6 years and the Chronic Living Conference, which was the culmination of the project, is we showed how it's not just about fixing the body, it's about living with that body which is afflicted by the disease. If we look at the everyday lives of the people who are living with diabetes, with cancer these days, with things like chronic obstructive lung disease, most of the time they're at home. So they interact and are reliant on hospitals and on biomedical care, but that's actually a very, very small part of their lives. 95% of the time they're at home, and then 5% of the time they're in interaction with hospitals and doctors. So that means we have a whole area of knowledge that medical anthropologists and others have contributed to gaining insights into, which currently is being unexploited. Nowadays, we live to 80, 90 years old, and that means that at some point in your life, you will have a chronic condition, and perhaps even 3 or 4 of them. So the improvement of the life that you are living in a biological sense has become actually in many ways an even more important healthcare objective. So that's the shift from saving life, keeping people alive as a primary healthcare objective to now having the improvement of life as a primary healthcare objective. What we need to do is to rethink healthcare, the way in which we hire people who work in hospitals, in clinics, but more than that, how we might rethink healthcare as something that takes place in the homes of the people who are living with diseases. So this is the moment, I think. We are at a moment where we could really advance the agenda of ensuring that qualitative insights into healthcare gets its deserved place in designing healthcare interventions.